So what do you think the body's long-term solution going to be? Well, Italian engineers are smart enough to look at the Tower of Pisa. You guys seen the Tower of Pisa? Does it look normal?
No.
Something's wrong with it, right? Well, it's a great tourist attraction, so that's great. If it wasn't leaning, nobody would be cared to see it. But you know, it's not sitting like this, is it? It's doing this. Now, over the centuries, it's actually gone more and more and more and more and more this way. This is essentially what happens to things when they start to go into a state of dysfunction, just like with buildings. If you leave them alone, they eventually collapse. We're the same way. Once that building starts to go more and more and more into this position, Italian engineers look at it, a couple of more inches is gone. Poof! No more tourist attraction. So they look at it and they go, wait a minute, that can't be. We're going to have to stabilize this thing so it doesn't go any further. What have they done? I was reading about the National Geographic. It's an interesting article. So they put a lot of stuff down here, concrete and mortar and counterweights and things like that, to physically stop it from getting worse. The other thing, they've also got cables hanging off us. So Italian engineers are smart enough to know this. Our body is smart enough to know this. It does almost the same thing. It looks at this and go, hey, I can't let this just collapse. If it collapses, I'm paralyzed. I don't live anymore. I got to do something about this. What tends to happen is the body will actually start lay extra calcium around the rim of this joint, creating more surface area, mechanically stabilizing it. Now, it's not going to move as well, but at least it's not going to collapse as fast. See, the body is always interested in cost and benefits, cost and benefits. If I put muscles in spasm, I'm not going to move as well, I'll be in a little bit of pain, but at least my spinal cord is not going to collapse. I'm going to put all this calcium around there, yeah, it's going to interfere with some motion, and eventually it's going to start creeping into little holes where the nerves come from, and those holes are going to get smaller. I might have some spinal stenosis. Anybody heard of spinal stenosis? Yeah. Okay. That's where spinal stenosis comes from. Anything that goes into a hole where a nerve is supposed to live, whether it's a bulging disc, whether it's these bone spurs, that causes spinal stenosis. There's other things that cause it, but those are the two things that more often than not. If you ever read enough MRI reports, you tend to see that a lot. These bone spurs have a function, stopping you from collapsing as fast. You know what we call this? Arthritis. Okay. Now, people have gone to doctors enough to know when they're being diagnosed with arthritis, there's another word that immediately follows arthritis. Age. Right? Now, invariably, if somebody past the age of 50 or 60 winds up in a doctor's office and they take MRIs, x-rays, whatever they do, and they go, Doc, my back hurts. Why is my back hurting? Well, you got arthritis. Usually end of discussion, right? Mm-hmm. Okay, well, why do I have arthritis? Well, you ain't no spring chicken, right? You know, you're past the age of 28 was the youngest patient that I've ever had that had that thrown at them. You're not 18, so you're going to have arthritis. Okay. Well, I got an argument against that. Arthritis is usually associated with age, isn't it? At least that's what we're told. And a lot of times when we don't have proper answers as to why some people get a lot of arthritis, some people seem to get a less arthritis, what is the second explanation that's usually thrown at patients when that happens? Genes. Right? Well, genetically, that's how it is. It goes back to your parents or grandparents where you just start to fall apart because that's how you're genetically designed. Well, or age. Those are the two things I'm about to debunk right now. Okay. And I'll show some pictures in a second that will show what I'm talking about. If you look at enough MRIs and x-rays, you'll notice a few things. When people have arthritis, you look at all the discs. If it were an age thing, if it were a genetic thing, you would imagine that all of them would become arthritic uniformly, right?
Yeah.
The discs are all the same age. Right?
Mm-hmm. Yes.
The genetic material necessary to develop all these came from the same DNA, right?
Correct.
So then why is it that that's not ever what we see? What we tend to see is massive amount of arthritis building up around one disc, a little bit less here, not much here at all, then a lot over here, then again not much over here, then more over there. It seemed to be in pockets of activity where the rest of the body is just looking great. I got patients in their 90s and you look at them and most of their discs look fantastic. Problem is the one that's really bad is really, really bad. Ultimately, remember, we're going to go back to kind of what we were talking about earlier. When you have disc dysfunction, you're going to have arthritis associated with that. We talked about why that happens. If you have compensations, you're going to have arthritis associated with the compensatory area. Then all of a sudden you got this. So you could very clearly illustrate every night and every day of the week that arthritis is associated with mechanical dysfunction, not age, not genes. Now, if I had to be in a court of law and establish that genes have nothing to do with it, I can't do that. If I had to say age has zero to do with it, well, maybe I can't pull that off either. But I can tell you this: those are extremely, extremely low on the priority list as to what brings arthritis about. It's mechanical dysfunction that brings it about. Okay. Otherwise, all those discs will be uniformly bad all the way up and down. Does that make any sense at all? Okay. Now that we've established what a bad disc is and all the side effects, a very important part has to come up. What do you do about it? What do people with bad discs do? Okay. How many options do they have available to them? Okay. Well, I'm going to go through them as quickly as I can. Epidurals. Anybody heard of epidurals? Okay, most people have heard of epidurals. What do they do in epidurals situation? What will they do? They inject that segment full of steroidal anti-inflammatories, and they usually it's got some analgesic effects to it. The idea is to numb the nerve and get the inflammation down as much as possible. That way, they create some relief for the patient. Now, does that do anything to change the structure of the disc?
No.
No. So what is the purpose of it? To create relief. Okay. I call that hospice care. Now, what does that mean? It literally means let's keep you comfortable while you're dying. That's essentially what it means. They've done absolutely nothing to change you mechanically. There's another thing that happens that people with really bad discs tend to be referred towards. And we call that spinal surgery, right? Now, not all spinal surgeries are the same. There's specifically 3 different types of things they do. One is called a discectomy. They got different variations now. They do they call minimally invasive, different things, but it doesn't matter. Ultimately, they boil down to the same thing. Let's look at the anatomy of a bad disc. You got the bulge here. You got the nucleus going off to the side. Annular fibers are sick, squeezing into the nerve. Therefore, you're not exactly happy. So what they do in surgery, they go, wait a minute, we know what's causing your pain. And they're right. They're looking at the MRI. They know which one's a bad disc. Usually they do. And they go, look at this thing's bulging out. So what we're going to do, we're going to just get rid of that bulge. Okay. Okay. Now nothing's squeezing in that nerve. Does that disc look healthy now?
No.
It's still not a happy disc, is it? Okay. But you figure, what the heck? Who cares? The bulge is gone and there's no pressure on the nerve. Okay. Then you would say, well, that's the panacea, fixes everything. Ultimately, then why is it that spinal surgery has such dismal results? There's one other thing that they do in spinal surgery. It's called a laminectomy. Laminectomy, I'll explain that real quick. This portion of the bone right here, that's called a lamina. They saw this part out, and just remove that bone. And the idea is to take the pressure off the spinal cord, and since the lamina goes down to the back of the nerve, the idea that, well, the bone's not there to squeeze on anything anymore, so as a result, the nerve is free and you're fine.
Oh, wow.
Okay, there's a problem with that. These things have a weight-bearing function. They actually help hold you up. Actually, the way it's been described is that if you look at the spinal column from the top, you got the disc, you got these 2 joints right there. It's really like a tripod configuration that's giving us our full stability. If you take any tripod and take 2 of its legs away, what's going to happen to it? Not exactly a happy thing. So as a result, laminectomies down the road tend to not have the best results for this reason. There's another thing they do in surgery, which is, let's just take, well, there's many ways of doing it, but I'll describe one. Let's just get rid of this disc and just fuse it all up. Fuse it. The disc isn't there anymore. Those holes are nice and big and wide and open. We shouldn't have any more problems. Is that the case? Then why is it that a lot of these spinal surgery patients tend to, also with fusions, tend to be bad? Because I see a lot of them myself. When you get rid of all function, now you get 0. Does that make sense? Okay? If you have a car where one of the wheel wells is not doing too well, and the mechanic's answer is to just fuse that wheel to the rest of the chassis, now we're not going to have any problems with that tire anymore, right? Now go off driving down the freeway. How is that car going to drive?
Not so well.
You would not do too well with that car. When you get rid of all function here, your body is going to have a problem dealing with it. And usually what tends to happen, actually almost every time what tends to happen, the disc immediately above it starts to get pulverized almost right off the bat. Because that disc doesn't really have the ability to compensate for the fact that underneath it all function is now gone. So now you're going to have a second disc problem that's very quickly going to be in your hands. And guess what's going to happen down the road? You're going to need spinal surgery. That usually it becomes like a serial spinal surgery effect, where you go jumping from one to the next. Is all spinal surgery bad? I'm not saying that at all. If you go in there and this disc is ruptured, you need spinal surgery. If it's sequestered, I'm going to go down a few things. Yeah, you need spinal surgery. If you have actually broken pieces of that, if you have stuff hanging out into the spinal canal, and there's debris involved with that, you need spinal surgery. There's time and place for spinal surgery. I think the most important thing to understand is what is the cause of the bad disc. The cause of the bad disc in this situation happened to be that the nucleus is not where it belongs. Now, a logical person might look at this and go, why don't we get the nucleus back where it belongs? What are we trying to accomplish by getting the nucleus back where it belongs? Remember, a bad disc is a complex array of situations. One of them is you get a bulge, squeezing down a nerve, you get a lot of scar tissue formation happening here. The disc itself is dehydrating because it's not moving, so we got lack of function, you got nerve compression, we also have a lot of connective tissue damage associated with it. All of these have their own symptoms. By getting the nucleus back, what are we actually accomplishing? We're taking the pressure off the nerve, we're restoring function. This is very important to understand. In my opinion, in my feeling, it's more the fact that we're restoring function to that disc is more important than all the pain you're in. Because that's what eventually leads to complete dysfunction. And that is this disc right here. What does that look like to you guys? I call it beef jerky. Okay, when a disc completely dehydrates and goes away, it looks like beef jerky. There's no definition. There's nothing you can do about this. And what happens when these bone spurs have gotten big enough where they're all touching now and fusing?
Oh, wow.
Okay, what is that? That is called complete 100% dysfunction. This is the sort of thing that lands people in nursing homes. Because you're no longer able to take care of yourself, you're no longer able to hold yourself up. The nerves have no place to go. You got so much stenosis going on in the spinal canal and the nerve roots that these aren't functioning anymore either. So you lost function. You can't take care of yourself. So ultimately, if we do have a mechanism, this is the big if, because this is basically where the only part any questions can be raised. If we do have a mechanism for getting that nucleus back where it belongs, then it's going to be hard, you guys are going to be hard pressed to make a case of, forget it. Okay, because once we get that nuclear material back where it belongs, let's just assume that's what we're doing here by doing this. What's going to happen to these annular fibers? Well, I'll explain. They will heal up. What's going to happen to that bulge? There's really no reason for it to be there, since there's nothing pushing it out. What's going to happen to this mechanical dysfunction that's associated with this tilt? Well, we're going to basically be influencing that back where it's supposed to be as well. I'm going to show you some x-rays that will illustrate this quite clearly. Ultimately, though, very important to keep expectations realistic. Am I going to take a 90-year-old who's had a disc problem for 40 years and give him a brand new 18-year-old disc again? It's impossible. Okay? This is a degeneration scale right here. The further you go down into the scale of degeneration, the harder it's going to be to take you back down to exactly nothing happened to you. If it is a recent injury, yeah, you can do that. Fix it. If it's been there for a while, we'll bring you back as far as we can, but you're going to be limited by how much degeneration is actually taking place in the disc. But you can always improve it. But this is our goal. Ultimately, this is our goal. Get the nucleus back, take the pressure off of the nerve, and restore function. Now, going back to what disc function is all about. When a disc is moving, it's creating fluid exchange. When it stops, you've lost that, now you're dehydrating and going away. When you get that thing moving again, guess what tends to happen? It actually starts to regenerate. Over time, a bad disc can get better and better with time as long as it's working.